Good morning, everyone. I have shared the attendance. Could you all please sign the attendance? Okay, and before I go further, let me get a consent for you for recording the entire session. Alright, thank you for that. Alright, once again, a very good morning to all of you, and thank you for joining the session today. Before we start today, I would like to acknowledge that everyone here are clinical instructor and have experience in supervising students. Alright, and I believe each of us have different way of teaching approach and the way of handling students. Alright, and in today's session we are not going to look into on how to teach, but our session will be focusing more on gathering the experience that we have gained throughout the clinical and how we have actually handled various various challenging situations throughout your clinical. And not only that, we're going to look into how we can actually explore the strategy to further enhance so that we can become a better clinical educator. And please take note that the slide is not the only learning tool for today, but it is based on our discussion that we're going to have in today's session. And I believe and I humbly request all your active participation during this session. So, before we go further, let me take the opportunity to get you all know in better. Alright, so may I know how many years of experience you have supervising? How many years of experience you have in supervising? Maybe we can start from here. Supervising students, 2 years.
3 years.
3 years. Okay, what about you? Miss Aslina?
One student, 5 years.
5 years. Okay, that's great.
I think around 8 to 9 years.
8 to 9 years. Oh, that's long.
Almost 2 years.
2 years.
10 years.
Oh, 10 years. Okay, so if you see, regardless of the experience that each of us has, some of you all have months of experience, years of experience, regardless of the experience that we have, our learning outcome is to learn and to gather experience from one another. So that is what our ultimate goal here. Alright. So prior to that, I want to divide you all into grouping. Since our topic is something to do with clinical effective, I will be adding 3 different groups. Alright. So for that, we have teachers group, the mentors group, and the feedback coaches. So for that, I will be sharing you a piece of notes. Alright. So this will actually determine which groups you belong to. Alright. So randomly pick any note and see where do you fall. Okay, so from there I want you all to sit. Okay? Yes. This is Cabutan Betua. All merah. Okay, so once you get your sticky notes, please change. Alright, so maybe we can stick those for feedback can go there. Mentor can remain, can be here, and the teachers group. Okay. And I think we also have one more mentor to join. So I think Kalini, mentor, she will join us.
Feedback.
So this is for the coaches group. So this is for yours, and this is for mentors group, and for the teachers group. Okay. Alright. Okay. So can we begin? Okay, no, that one later as we go through the quick reflection. I need you all to describe yourself as a clinical instructor in one word. For example, for me, if you see, I would say that I'm a supportive instructor. Supportive. So, I give you 60 seconds for you to think about and describe your own self. Alright, your time starts now. Alright, so I believe 1 minute is over. So which group is ready? Alright, the mentors group. Okay. So yes, the rest, I think we can hear from your friends what is their way of describing themselves as a clinical instructor. Yes, we start from mentors group. Miss Priya?
Describe myself as a cheerful clinical instructor.
Cheerful. Wow, very good. Keep a Right, next we'll go to the feedback coaches group.
Okay, I will say like I'm an adaptable clinical instructor.
Adaptable. Alright, great. Next.
I'm described as apa dia tengok?
Fascinating. Okay, alright, great. So reflecting from the word, that one word that you have actually described yourself, that actually reflect on the type of clinical instructor, basically your teaching approach, your teaching values. So this is what that one word actually reflects. Alright, so moving forward, teaching approach that we have described. So we're going to further see how this various teaching approach going to influence our student in clinical settings. Alright, with that, the learning outcome for today's session is basically to identify what are the different clinical teaching styles. As you can see, each of us differs from one another. And from knowing the clinical style, how are we going to apply this approach towards our students? Alright? And when we talk about mentoring, mentoring is also one of the important strategy. So this will actually add to support the students who are at need. And talking about feedback, I believe every one of us give feedbacks, right? So is the question whether are we giving constructive feedback, whether the feedback that you are going to give is that effective enough to make the changes in students themselves. Alright? And not forgetting, we are also looking into assessment bias. I'm sure being a clinical instructor, clinical educator, we need to evaluate our students. We need to assess. Okay? So the assessment involves midterm, final assessment. So irrespective of the assessment, are you all giving the mark that it is supposed to be? Are you all rating what it is supposed to be? Alright? No, I closed it. Are you all rating what it is supposed to be? Alright? So that is where we are going to look into assessment bias. Sometimes even without we realizing, we tend to be biased. Okay? It may happen to any one of us. So that is where we are going to identify what are the bias when we are providing assessment for the students. Okay? And last but not least, we are going to look into how are we going to manage challenging students. Have you all have come across challenging students in your clinical practice? Yes. So how many of you all have not come across challenging students? So I believe each one of us has come across, and each one of us has different stories. So whether are we addressing that issue correctly or not? So what are we in right track? So that is what we will look into in today's session. Okay, so alright. Okay, let's begin by considering why clinical teaching is so important. Alright, as I said, every clinical instructor teaches differently. So this includes, like, if you see in terms of advantage, we have diversity. But on the other end, it can be a disadvantage where there is inconsistency among us. So when there is inconsistency among us, it can actually affect the students' learning experience. And not only that, as you all know, every one of us being a clinical instructor are highly competent in our field. But the question is, are we actually receive a formal training for proper clinical instructor training? Okay, so this also could influence the teaching experience to students. Alright, and as you can see, teaching and mentoring requires different set of skill when you want to deliver to the students. And overall, effective teaching in clinical, it can influence students. Alright, so it can influence in the form of their confidence. So what I mean by confidence? So some students, when they have good knowledge in theoretical part, but when they come to clinical, they may not be that confident. So that is where your role is not only teaching, but you play a role in mentoring them. Okay, build their confidence. Okay, so that is how it can influence. And apart from that, the effective teaching will also help improve students' competency, and you can stimulate their clinical reasoning. Alright, and not limited to developing their professional behavior. So in clinical, we don't only look into their teaching wise, right? What are the other areas that we look besides teaching? Yes, very good. Attitude. Other than attitude, what else we look into? Only attitude? Communication. Very good. This is one of the important aspects. Alright? Other than that?
Professionalism.
Ethics, professionalism, how they come, what is their punctuality level. So all these, they are not evaluated in normal classroom teaching. But when it comes to clinical, we are going to look into that. So that is where we are molding their entire profession. Overall, when we look into effective teaching, it will improve the overall placement experience. Moving forward, now that we explored the importance of clinical teaching, let us look into the various clinical teaching styles. As I go into this, I want you all to take a moment and reflect among your own self which type of clinical style that you use when it comes to clinical teaching. Alright? So we have 4 different types. Okay? One is the demonstrator. That is where I show you and you are observing what am I doing. Okay? That is where the characteristic of the observer. Next thing, we have something called the director. That is where I will tell you to do and you follow what to do. So that is the teaching style of the director. And we also have facilitator. So for facilitator, they will only guide and they will want the student to think. They will not show, or they will make the student as an active learner. And lastly, we also have something called the mentor. When we talk about mentor is someone who actually guide. Sometimes, as I said, the same scenario. Some students, they are good when it comes to theoretical knowledge. But when it comes to clinical, they are unable to perform. What is lacking there? So that is where the role of mentor is to guide and to support the students throughout the teaching. Alright? So let us go deeper into this to understand the further on each of these roles. Alright? So as I said, the demonstrator, so the teacher or the instructor will demonstrate. Okay? So in clinical, we can see, for an example, a clinical educator demonstrating a student on how to train a gait. So from that, student will learn. Another example is where a clinical instructor was performing suctioning on the patient. So immediately we cannot let the student to do, but we show them how to do. So from there, student will learn through observation. Okay, and this type of teaching will be very useful in case at the beginning stage. When the students are too new, you can't straight away ask them to perform a suction, right? So that is where you need to demonstrate. Moving forward, as I said, the director, this is where the director shows you and get you to do the things. That means to say the educator teach you and get you to follow the instruction. For this teaching method to be effective, the instructor or the educator have to provide a clear step-by-step procedure so that the student don't go wrong. Okay, so for example, when we talk about in clinical scenario, we can think about cases like you're asking the student to do or to teach your patient to do isometric quadriceps. So you as a teacher or the educator, you tell them, okay, now you need to keep your legs straight and where which muscles you need to contract. So this is another method of delivering the teaching. Alright? And so this is also again best used when you are the beginners or when you are at the learning stage. Alright, learning new skill and you need a clear structured guideline. It's very important, the key point here is where clear guideline or structured guideline. If your direction is wrong or if you miss one component, that can go wrong. For example, same thing. So once you have demonstrated and once you get the student to direct and do the suction and you forgot about telling to wear gloves, what happens? So student may also tend to miss that aspect. Alright? So when you are giving a direction, it has to be in a structured way. Alright? Next, we have facilitator. So as I said, what is the role of facilitator? What the facilitator does? The facilitator guide. Okay, but they let the student to actively participate, think. Okay, so what scenario we can apply in clinical based on your experience? Anyone can share. So when it comes to clinical situation, what are the facilitated way of teaching?
I think as a CI, and pick up actively in all those. As we are having our semester 7 students, they are very freshy. So for them, we will start as a demonstrator.
Okay.
And slowly,
yeah, okay. Alright.
So that's how I think all the CIs will choose like each of it in every sequence. Depends on which semester and which student we are dealing with.
So when it comes to facilitator, what example, like, how do you deliver the teaching? So for example,
So for example, if like we have very simple case like fracture, so we let the student just do the objective, subjective and objective, and then discuss like, okay, now what is your finding, what is the problem, and then what is your plan of treatment, and then from there we discuss, okay, so what do you think for this problem, what you want to do, from this one, what you want to do.
Yes, that is the exact role of facilitator. So basically, facilitator will guide the student and explore their thinking skill, their justification, their reasoning. Alright, by asking, like once the student has completed the assignment, the role of the educator is where they ask, why did you choose odd pack over cold pack? So this is where it will prompt their proper clinical reasoning. Alright, so when we talk about facilitator, this is a useful way of teaching when it comes to students who already have some existing knowledge, some basic background. So if you ask something that they don't know, they may not be able to answer. But if they have some exposure towards hot pack, cold pack, they have already learned, then yes, they are able to reason out. Okay, so this type of learning will be suitable when it comes to students who have already existing knowledge. Alright? And the last one is where the mentor. Talking about the mentor. So I'm going to give you the same example. Patient Lim is very good when it comes to theoretical knowledge, right? So in exam everything is perfect, all 3-pointer above. But when it comes to clinical, he may not be able to perform. Where is lacking is not his theoretical knowledge or his technical skills, but what is lacking there is interpersonal skills or his confidence level. So that is where the role of the mentor. Educator who are being a mentor, they try to actually guide the student through mentoring, okay, by building their confidence, alright. And not only that, they tend to discuss what are the problems, what are the challenges that particular student facing. So from there, they will try to rule out a plan for that particular student. So that's how the teaching style when it comes to the mentor. Alright, so as we observe all these 4 different styles, okay, we have the demonstrator, director, facilitator, as well as the mentor. So let's look into this.
Generally,
Everyone. Alright. So when we talk about the most independent physiotherapy graduate type, alright. So it is basically, in reality, students overnight cannot become a facilitator. I mean, they cannot independently think themselves, or they cannot critically analyze a problem. Or it comes over a period of time. They start from the beginning, and that is where eventually they develop their critical thinking skills. So, in another word, this drives us to the clinical instructor journey. So, it is actually from demonstration all the way to direction, and eventually they become a facilitator, and then mentorship in between, finally independent physiotherapy. Alright, so the journey doesn't only stop at facilitator, or doesn't only start at mentorship. So it depends, okay. But overall, we go through all the level. Alright. So with that, is there any question towards the teaching style? Okay. So as you all in 3 different groups. Okay, and I believe I have given you the envelope. I need you to open up the envelope, and you can find a case scenario there. Each group will receive a different clinical scenario. Alright, so which one is that? Who has the scenario 1? No, not this one. The pink color. Open the pink color envelope. So you're going to do that first. Alright, pink color envelope. So what you need to do is where you need to discuss in your group to know what is the teaching style that can be used for this particular scenario, and what is the most appropriate approach, and if transition, would you do the transition, and please justify on that. So for this activity, I am going to give you 10 minutes to discuss and come up with your answers and share your answers to the rest of them. case Sarah. So maybe you can present. So before that, can you just read the key point here from the scenario?
Okay, the key point is Sarah is a first year physiotherapy student and she is on her first clinical placement, and she was supposed to perform a transfer on a patient who just did a TKR surgery, and then she is anxious, repeatedly asked for reassurance, forgot several safety steps and unsure about the transfer. So what kind of teaching style will we choose? We will go for demonstrator, because she said she's anxious and repeatedly asks for reassurance. So to make sure the student doesn't compromise safety of the patient, we will prefer to be a demonstrator there. So we will demonstrate the transfer, how to do the transfer safety to make sure the patient is safe.
Very good. Next.
Why?
Next will be what is the most appropriate approach? I think you answered that.
Why I really answer the third question.
Yeah, we want to
So
do that.
for the third one, we will become the facilitator, because here we already taught her how to do it and everything. So now we want to re-evaluate her skill to see whether she is competent enough, and reassure that she doesn't forget everything. By being a facilitator, we can monitor ourselves.
Alright, very good. Good answer. Alright, do we have any different opinion from what our mentor group said?
Yes, for the third question, I think maybe they can start with the demonstrator first. After that,
For the third answer, is it?
third
Question.
answer. Just not say facilitator, right? So we think maybe we can, as a clinical instructor, maybe we can demonstrate to the student first, since the student unsure on the proper transfer technique.
Okay, what about the other members from the group? Do you have the same opinion with your team?
I think because sorry, I think because they already the teaching style they choose first is demonstration. Choose demonstrator. So and then after the demonstration then they move with the another teaching style.
Yes, exactly. Alright. So if you see, this is a scenario where the student is at the beginner stage, first time doing, and nervous. So we cannot straight away ask the student to just perform like that. So as what this group have discussed and mentioned, so the ideal answer would be we start with the demonstration. Alright, and then yes, when it comes to progression, that is where we progress up to the facilitator. So that will be later part where we want to see whether the students have mastered the skills. So that is where we progress with the facilitator. Alright, so I think everyone can agree with the answer. Alright, so yes, good, well done. And next, we're going to look into the scenario 2. Who has scenario 2? Alright, the teachers group has that. Before you go into your answer, can you please summarize the key point of the scenario?
Okay, so basically Jason is a final year physiotherapy student. Okay, when he gathers all the information, relevant patient's information, but when asked to select why he selected particular treatment, he says that he struggles to justify his clinical decision, and he always responds that because this is what I learned in class, this is what my previous CI does. Okay, so I noticed that Jason relies heavily on memorization rather than critical thinking. So the question is, which teaching style would you use first? So we will go for facilitator first. Okay, and why is this most appropriate approach? It's because first thing, Jason is having lack of critical thinking. Okay, and then we direct them. Why we are selected facilitation? Because to ask more questions and to direct them in a correct way. And since they lack of critical thinking, this helps them correct him in a correct way. And then the third question is the transition to another teaching style. We will choose for the mentor style.
Why do you think mentorship is needed here for the progression?
Okay, so since we have facilitated him initially, so in what happens is in future he does not feel that we are pinpointing him. So this makes him to feel more encouraged, and he feels that he has given him a constructive guidance in a way, and then he will feel motivated as well. So this makes him to feel more confident.
Very good. Alright, well done with your answer. Okay, the other group, mentor. What is your opinion on the answers that has been shared by the teachers group?
It was a good idea, but
The rest, we can get the feedback from it and then we can continue. So, yeah.
it was a good idea, but I would suggest we will start with mentorship first and then the facilitation.
So we start with mentorship and then the
Because he's
facilitation.
a final year student, so he has some knowledge with him. The only thing is the way he think. So we can mentor him the way for him to decide what treatment suits rather than facilitating him.
Okay, so if you see the mentor group has a different opinion from our teachers group. So for this scenario, our teachers group said that they want to start with the facilitation and then they want to progress with motivation. And what about the feedback coaches?
What was the first answer?
Facilitator.
So what is your
So we think we will start with the director. I think for me, for us,
everyone has different opinion. Okay, so then
I
now-
think we will start with director because these students, like, he doesn't really familiarize with the critical thinking. So at first maybe we give direction. Okay, so instead of using this, okay, why don't you use this because this one did it. So we direct him with the direction, like this is I choose this because of this, because of this, because of this. Okay, and then let him think back, and then after directing, and then we go to facilitating, and after that we just go back reverse to the mentorship. I mean, like,
why not demonstrator? Because it's already like final year. He can do the assessment confidentially. He can do everything. But when it comes to clinical reasoning, he's lacking that component. So I think we need to start from the beginning.
Okay, thank you. Thank you for your different perspective towards this scenario. Okay, but to throw back to this scenario, in this scenario, if you all observe, these students is actually lacking of clinical decision. That is the main variable. What qualities that actually, for you to think even up to now. So I give you about 60 seconds for you to think about your clinical instructor, the best clinical instructors, and why, what qualities. Alright, maybe one or two words. So maybe you can drop down the qualities in the paper of in the piece of paper. Yes. Minimum one.
Oh, minimum one.
This is group activity or individual?
Individual. Each of you has different clinical instructors, right? So each of you can. Alright, so I think it's time's up. So let's hear from you all. we start from this side now. Okay, so could you share with me what is the qualities that is most memorable from your clinical instructor?
Okay, this was my very first clinical posting back to my study time. I met my clinical instructor. He actually, for me, he fulfilled all the criteria I needed. He's from the
I mean, you're specifically one thing that you remember. If let's say I'm going to chop off this.
knowledgeable.
Alright, very good. Okay, what about you? Miss
I
Prema?
never had a CI before, so I only had more like 1 year of practical experience. I had my lecturer coming here once.
In clinical teaching.
Yeah, so maybe I can say knowledgeable.
Okay, knowledgeable. Okay.
I also have no experienced clinical instructor. We only have lecturers. So in terms of, they also come in to educate us. So I think his name was Mr. Mardelin, and for his knowledge.
Knowledge. Alright. Yes, Miss Priya.
I would say the best clinical instructor I had was approachable.
Approachable.
Approach at any time
Okay.
for guidance.
Yeah, that's interesting to know. Yes, Miss Farila.
Okay. Well, I think I only have one experience with a clinical instructor. He's not really a fully clinical instructor, just a visiting. But it's quite hard to choose one. I would choose two, but first one I think is approachable,
Okay.
and then second one is supportive.
Alright.
Yeah.
Okay. Very good. Yes, next. Miss Asmina.
The best CI that I had, actually I seem like I don't have fully CI, but the physio itself is my CI. So the one that most favorable, of course, approachable and supportive, because we don't have a fully CI. So whatever the physio that we follow, so of course she or he is supportive.
Alright. Yes.
Okay,
Miss Kenny.
myself I would say approachable, most of them is approachable.
Okay. Alright. So, from the answers that I've actually gathered from you, what I understand is where the experience is not only from knowledge that you admire or you remember your clinical educator, but it is also on the other aspect, whether they are approachable, whether they are supportive. So, these are the things that actually bring us for long-term remembrance. It's not about, like, sometimes it's not only about the skills that they know, but how they actually make us feel, how they encourage us throughout the posting, right? Whether they humiliated, have we ever gone through embarrassment, have we been very active? So these are the feelings that also matters when it comes to clinical education. So with that, that brings the topic of mentorship. Alright? So here we're going to look into, is there any difference between teaching and mentorship? If you see, yes, there is a difference when it comes to teaching and mentorship, but however, these two terms are used interchangeably. So, looking into what are the difference when it comes to these two, let us explore further. So, when it comes to teaching, teaching is basically something that we focuses on skills and knowledge. Whereas, when it comes to mentoring, we are actually focusing on personal and professional growth of that particular individual. Alright? And as we can see from this comparison, teaching and mentoring serve a different purpose. Alright? As you all know, teaching is to acquire knowledge. So that is where students will ask, what should I do? And you teach them. But when it comes to mentoring, what kind of profession should I become? So that is where you mentor them by giving them the direction, giving them the goal, understanding their interest. Okay, so there is two different things when it comes to teaching and mentoring. Alright, so as a clinical instructor, we may end up using both this when it comes to clinical. Sometimes you may not realize that you are mentoring or you are teaching, but perhaps you may come across this both situation when dealing with students. Moving forward, when we talk about memorable mentor, as I asked you all just now, beside knowledge, alright, what else that actually attracts us is when a mentor is approachable. I think I heard from few of you all saying approachable. Why it is approachable matters for effective learning. Because when we as an educator are approachable, student may not be feared to ask us any question. So that in that way, that will help for their learning development. Okay, that is where again, if we are approachable, imagine we are sitting at the corner, tying up our ends, and we are being very strict, answering all the questions. So do you think if the student has any doubt, definitely they may not come and ask or approach us because of the fear. So in that way, what happened? Their learning progress will be affected. Alright? So that is the characteristic that we need to build when it comes to being a good mentor. Other than that, being supportive, I think everyone are being supportive towards their students. Being trustworthy, this is in case when they share something, we need to keep it confidential and we need to trust and do not be judgmental. Alright? And another most important effective characteristic of mentor is being a good listener. Let your student talk first. Alright? Let them finish the entire conversation before even you go and give your input. So a good listener will become a good mentor. Alright? And next, reflection, very important. Okay? Encourage the reflection. So basically, when students come and tell you any problem, what is the first thing that you need to do is first listen to them, understand their concern, and then reflect them. Ask them to reflect. What went wrong? Why went wrong? How would you do in better in next time? So these are the reflections which help them to actively change their behavior. If you are the one who going to go in, give input, you do this wrong, you do this wrong, you do this wrong, you do this correction in future, they are not going to feel that. So it's very important for themselves to reflect their own lacking, and from there they need to provide their own solution. Okay, this would be better if I do this way. So when it comes to assessment, some students, they might miss out their red flag sign when treating a back pain. So this time it's okay. So at the end of the session, you can ask them, what are the things that you have missed out? Where have you gone wrong? So what are the things you can do for your betterment in next time? So this is where reflection plays a role. Alright? Next thing is where providing honest feedback. Irrespective of students, sometimes when in clinical situation, we come across students who are very difficult, very adamant, very big-headed, I would say, alright? Or on the other end, we have students who are very emotional. They break down easily, alright? Irrespective of the student, it is very important on us giving the honest feedback, but again, there's a but here. So the but here is for giving in a constructive and polite way. So that matters. Alright? And of course, lead by example. When it comes to clinical, we are an example to the student. They also see us how we actually communicate to the patient, how we actually communicate with the other healthcare members like the doctors, the nurses, how we are. So from there, they also keep us as a role model, and that is where they lead the example. Alright? So these are the characteristics of effective mentorship that you need to develop. And I believe all of you have this, but it's just that you need to refine further. Next, the most important aspect. For us to be a good mentorship, you need to build a trust and psychological safety. Alright? So this is the one of the important aspect. When psychological safety here means students are comfortable. Okay? Students are comfortable to admit the mistake. Students are comfortable to share that they don't know. Students are comfortable to approach you anytime. Okay? Why? Because they feel that they are psychological, they have the safety that they feel that okay, this educator I can easily approach, irregardless if they are making mistake. Alright, so that mistake, they create, instead of finding fault on them, we are actually rerouting and directing them as a part of learning. We don't see the mistake as a failure. Alright, so how we do this is because we create that from them. So that is why they feel safe when they want to share something. And not only that, as I said, they are easily approachable. They can seek help anytime. Alright, and whatever doubt they have, they can ask any question. They don't feel humiliated. Oh, this educator will look me down. This educator will embarrass me. This educator will go and share to other 10 students about me. So they don't feel bad about themselves. So that is where they don't have any fear of judgment. Alright, looking back into the effective mentorship that I was telling, trustworthiness, this is where it comes into the picture. Alright, and yes, feedback, as I said, pointing out feedback is very important, irregardless of the student. Feedback has to be given, but the most important here is whether are we giving it in a constructive way. That matters. That will actually support their professional development. Alright, moving forward. And yes, expressing their certainty. Alright, so they are safe to say I don't know. Alright, they agree that they don't know. All this happen if they feel that we are trustable and they feel that they have a psychological support from us. Otherwise, you may not find this from your students. Alright, so as I said, as a student, as a mentor, we want the student to view their mistake as a room for correction and room for improvement, not as a failure. Alright, so we don't want to criticize the student or lower the students. Alright, so our ideal goal is to create a safe and respectful and supportive learning environment. Okay, and as I said, when it comes to clinical instructor, I'm sure every one of us faces a lot of challenges, and it is not easy when you deal with students because different students have different way of showing up things. Alright, and yes, so as I said, we very important effective mentorship is where when we have proper rapport with students, that is where they are able to develop a proper confidence. They tend to be confident. Alright? When they have confidence, their outcome will be better. Their learning outcome will be better. They are not afraid of asking you and doing mistake and correcting themselves and moving forward. Because they know they can learn. Alright? Other than that, professional identity. Okay, they can develop accountability to whatever things that they are wrong, and they again bring themselves up, walk through themselves up. And other aspect is where communication skills come into the picture. Alright, so yes, this is where they will develop on how to improve patient interaction, okay, and reflective practice. So this is also another component. As a mentor, we play a role in asking them to reflect back so that they know what exactly and what exactly they did and what exactly went wrong. Okay, and of course, as a mentor, we also help for their career development. We do not only talk about skill, but we help them for a student to recognize which area that they are good, which area that they can further excel or they can work on, even when it comes to career, not only during the clinical. Sometimes students fail to recognize. Okay, so we as a mentor, we can work on that. And resilience and well-being, when I talk about this, of course students also have a lot of issues, okay, financial issue, stress, personal problem. So we need to actually support them during the challenges, alright? And that is where our role to be a good mentor. alright, and encourage adaptability. Alright, so the question here is how can you support your students beyond clinical teaching? It's not only about clinical teaching when we talk about mentorship. Any questions so far? So with that, we are going to jump into another activity. Alright, so this is where we're going to apply whatever concept that we have learned, teaching and mentorship. Alright, so in this activity, so for this I have given you all a scenario. There's a next paper on that. As you read the scenario, think beyond the clinical skill. Alright, read carefully what is the student's main issue, and the students need what type of coaching, whether it's teaching, whether it's mentoring, or whether it's both, and how would you respond to the situation as a clinical instructor. So if you look into the scenario, some of you all have gone through this. Okay, so I'm going to give you another 10 minutes for you to discuss and write up your answer. Okay, alright, your time starts now. Facing, and when it comes to this kind of student, what we do is more of mentoring instead of imparting clinical knowledge. Alright, so and how we can respond beside what your friend has shared, we can also break the task into smaller, maybe like get her into, and because she's afraid of talking in front of the others, so maybe we have a small group and ask her to share a discussion among small group before we go into the bigger group, so that let her to build confidence. So that is one thing that we can do, and apart from that, ask her to reflect back what is lacking on her, what are ask her to come up with a solution by herself, what are the things that she needs to improvise. Okay, so acknowledge this thing, and also encourage her to participate in low pressure setting. Don't set away, with a lot of people, she might get even more anxious. So encourage her to practice in a low pressure setting. Alright? And yeah. So these are the things beside what your friend has shared. Okay? So I think any other points that you guys want to share? How you can respond. So if you yourself encounter this, how do you respond? Besides, okay, more or less the same. Okay, alright, thank you for that. So let's move on to the next scenario. Okay, next scenario, we are focusing on Jason. Alright? Alright, so Jason is, yes, who got Jason scenario 2? Yes, please summarize the key scenario.
Okay, so Jason is a second year student and now doing a posting. He always prepared and willing to learn, but he doesn't really know how to apply the knowledge and always wait for the CI to guide him and to give answer. And recently he just comments that he studied all the notes, but he don't know where to start when he seeing the real patients. Based on the scenario, what is the main issue faced by the students that we are discussing is first lack of a knowledge. First is a knowledge actually, the theoretical knowledge. So from the knowledge itself, on the reasoning, and then when he doesn't really have a good knowledge, okay, the application skills also might be affected. Okay, so like he don't know when to start, how to start, and then what he need to do when seeing the patients, like whether it's safe or not, whether what he did is correct or not. Okay, and then moving on to the questions number 2. Does the student need more teaching, mentoring, or both? from our opinions, we thought that these students need both. Okay, first because we cannot just teach these students, but also mentoring because first he's doubting himself. Okay, so of course we need to make sure we give him, we listen to the problem and give guidance. At the same time, we still need to teach him because he
guidance to plan for future career direction.
Alright, okay, well done. Okay, any other answers from other groups that you want to share from this scenario? So, here, talking about the primary problem here is not the competence level, but it is more of burnout that the student facing. Okay, burnout and more of reduced motivation. Alright, so looking into the medium of teaching, yes, mentoring will be more effective in this case. Alright, and how do we apply this as what your friend has shared? Apart from that, we can also set a goal for them. Okay, and again, reflection would definitely help this better. Alright, set a goal, discuss, okay, support. All these will be beneficial in addressing this situation. Alright, and here we also provide emotional support. Okay, very important, emotional support. Okay, so with that, we are done with this. Any questions? Any questions? Alright, so that comes, looking at the scenarios that we have discussed, one thing that has come, it is clear, is where every student doesn't require the same medium of teaching. So some may require mentoring, some may require teaching, some may require both. Alright? So if I have a good future physiotherapist. And so if there is one message that I would like to share in this session, is where clinical education is not only about assessment and all that, but it is more than that. Okay, it is basically on how we can shape professional, how we can identify them, confident and lifelong learning. Alright, so with that, we are done with this section. Any questions? Any question? Alright, so far we have discussed about what are the teaching styles, right? We have also looked into the mentoring, okay? And let's look into the assessment part, okay? As a clinical instructor or clinical educator, assessment is one of the important components, right? When assessment comes into the mind, it's all about grading and marks. But it is not only that, it is more to that. Okay? So let's look into detail on why assessment is not only about grading. Okay? It is about monitoring the progress. Because when we assess the student and when we allocate the appropriate grading or assessment for them, we know where they stand. And the next level, when they do, we can see whether are there any progression from the past. For an example, we have midterm assessment, final assessment. Why there are two assessments? Why can't there be one? So again, this will help to gauge their progression, right? And when we have assessment, we can exactly know where is the learning gap. Okay, for example, the student who scored mark 70% in the exam, but if you see one particular component 0, for example, subjective assessment. So we understand that this student has issues with subjective. Maybe student have knowledge, but is that the way how to ask questions? Is that the way how to communicate? So through assessment, we can actually understand what are the issues, what are the gaps that our students is having. It's not only about giving mark, alright? And promote competency, alright? So this is where we understand their competent level, okay? And next, most importantly, is where assessment will help to ensure patient safety, alright? By ensuring students are able to practice safely and effectively, Okay, because our students mainly dealing with patient. So in order to do that, we understand their level, we need to know whether are they competent to up to that level, whether are they competent to handle the patient. Alright, so we don't want to by any chance compromise the patient safety. Alright, and ultimately the purpose of assessment is not only to judge the student, but again to prepare them for independent practice. Alright, so that is the ultimate goal. Moving on, we know that assessment is easy. Alright.
Students with
Yeah, what do you find mistake, or sometimes when you want to tell them the grading, or sometimes that you may not have time. It's your perspective. What challenges you face when you are assessing student? You can hear this is a discussion. Okay, I think you all are still discussing. I'll give you all more time. Alright. Can we continue our discussion? Alright, yes. Let's hear from this group. Yes, could you please share the challenges that you face?
As for the current few semesters we are facing, the number one is when we are dealing with international students, China students. Due to the language barrier, it's very hard for them to understand our evaluation. So there's still a barrier. So we cannot be like, we truly don't understand how much they understand from the feedback of our marking, our evaluation. So that's one thing. And then very common one is up to today's date is that it's the comparison between the CIs. So let's say it is not a vast comparisons like okay, a CI is giving them a B and another CI is giving them an A. It's not that comparison. Both are giving an A, but one or two marks different on that A's.
Okay.
So that has become like even we as a CS is like okay, how we we don't talk to each other. We don't know how we are doing in a different space and all that. And then the acceptance towards the marks for the lowest one. We already give them face-to-face feedback. We already we scribe in their slide wherever there's a mistake. So apart from this, even before the levers, we still sit and ask, are you okay with everything? Because maybe I'm not will be there for you if you want to ask anything. So clear off anything before you sign off. Then they will say like, okay. But in their heart, when they score very low, the acceptance is not there.
Okay, thank you for sharing your challenges. Alright, let's move on to another group. What are the challenges that you all face?
What we face is basically when we have corrected the students, I feel the students still make the repetition. Still learn to make, especially like we are correcting the grammar, but I feel that students still making the repetition, the same mistakes again and again. Okay, and their attitude. When we are correcting, we expose the marks and the criticism marks, we can
can see the face like we try to show how can I help these students.
Clinical side, you feel guilty of being
Yeah,
such
and
nonsense.
in other ways like this is a very good students in the knowledge wise,
Mhm.
but we know that the behavior is not that good, attitude is not that good. Or maybe sometimes when this is very good student, but when something exam, because of the panic, nervousness, anxious and everything, they didn't really perform well. But we know this is a very good student, but we cannot judge her or him based on the previous experience. So we need to judge him during that exam. So it's very hard for us that whether we need to give him accordingly or maybe we need to
Consideration.
Yeah.
Consideration when assessing.
Okay, very good. Any other points that from here?
That's
Okay, so yeah, as you all said, I agree with all the challenges that we have faced, right? So giving mark, right? Students are demanding, students are not accepting, right? So these are the things that we have. And apart from that, sometimes what we also faces is where I don't know whether have you all encountered time constraint. Okay, because you need to teach them, you need to mentor them, you need to see them with the patient. At the same time, you need to do assessment. So as a clinical educator, I do understand this is very common issue. So it is very important to balance between all these responsibilities. And next thing is where large student group. Okay, some areas that you might find that there's more students. So in terms of allocation of time will be more compared to the other area. So what happens is where sometimes we tend to give or do it fast. And certainly we tend to overlook certain component, alright? And inconsistency of student preparedness, this can vary considerably, alright? So this is where some students require minimal assistance. Like some students, they don't need much assistance. So when we are going to teach something or we're going to provide anything, any set of skills or knowledge sharing, it will be very challenging because each of the students has differ in terms of level of preparedness. Alright? The next point is where subjectivity and bias. As what our friend told just now. So she feels guilty when she wants to give that kind of low mark. Alright? So, but yet she has to do it. Alright? But what happens is where there is tendency, we tend to be towards biasness. Okay, looking into a personal this thing, looking into an outbreak or emotional outbreak that she had, we tend to be lenient. So these are subjectivity and biasness. Alright? And giving constructive feedback. So yes, as some of you have pointed out, when you are giving feedback, how would be the reaction from the student? This is one of the challenges. Whether they are demanding, whether they are arguing, defensive. Alright? So yes, alright? So these are the issues that you might encounter, alright? Another major challenges is how you can balance the assessment with teaching as well as the clinical duties. Alright? So this is also sometimes, yeah, as I said, going back to the time constraint, alright? Yes, leading to that, we're going to look into what are the biasness. Alright, when we talk about when it comes to assessment, one of the main problems is where being biased. Alright, so we're going to look into biasness. But before that, let us run through on what does a good assessment looks like. Alright, so I believe our judgment should be based on the objective. Alright, the assessment that we're going to do for the patient, it has to be objective. Okay, that means to say that we have in our clinical we have certain rubrics. So we have a clear criteria when to rate if the student is good, when to rate if the student is poor. So this is where there is an objective measure, and this is based on the observable behavior. It is not based on the judgment. What we observe, we provide that rating. Alright, so that is how our assessment should be. Alright, and next is where assessment should be fair. Alright? Every student should be assessed based on the same criteria. Alright? Irrespective of the level of competence or other situation. Alright? Irrespective of that, we need to assess them in equal and same criteria. Alright? And next is where, yes, consistent. Use the same method. If you have 5 students, all the 5 students you need to be consistent. Alright? Assessment should be consistent and also transparent. You should be able to share your rubrics. You should be able to point out where is your lacking. Alright? Be transparent. If you're going to give accurate grading, then transparent comes into the play. Alright? And another key point here is where assessment has to be based on observed performance. Okay, whatever we are observing, based on that we are giving the mark. Alright? And finally, assessment should be development. The idea of we giving assessment and providing feedback is for them to improve. This is basically to support their learning, and again not to pinpoint or find their failure. Alright? And when this principle look into, assessment become a valuable tool. Alright? Rather than we simply giving a grading for a student. And yes, despite our best intention of having a proper assessment, there could be some potential bias that can happen. Even sometimes we don't realize that that is a bias that we have done. Okay, so let us look into what are the potential bias that we can or we may face in clinical education. Alright, one of it is where halo effect. Okay, so this means to say that even we have a clear assessment criteria, we know there is a proper rubrics. But what happens is where one strength influence overall rating. For example, we already have this student, she is very good student. So automatically with that mindset, we tend to rate that student. Oh, she is a good student. Yeah, sometimes we fail to understand that she is good, but when it comes to this component, she might not do well. But what happens is where we have the halo effect. We are being biased by pre-assuming that she's already good. Okay? So that is one of the type of bias. Another one is where on effect. It's just opposite to that. Okay? There are one weakness where it can influence the overall rating. So this is where, for example, this particular student every day comes late to the clinical posting. But what happens? When it comes to assessment, we take that negative input that the student has or negative impression, and we also tend to translate into the assessment, which we should not do that. Okay? That is separate entity and these are separate entity. This is how we should deal when it comes to assessment. We have to rate based on that particular component and not getting other factors to become the influence of our current rating. Right? Next, similar to me bias. So similar to me bias is where sometimes we come across students that who are similar to our characteristic, our nature. Alright? So they resemble the way how we do things when we are clinical, or we tend to put ourselves in their shoe. When we are students, we do the same thing also. So that drawbacks towards the biasness. When it comes to assessment, we tend to, oh, it's like that, like us. So this is also one type of bias that we tend to encounter when we are doing the assessment. And leniency bias. What is leniency bias here? So this is basically giving higher mark than what they deserve. Sometimes we are too lenient. Never mind, just give. So what happens at the end of the day? The student is supposed to deserve 50, but we end up giving 90. So when we do that, there is no room for improvement for the student. The student might think that they are very good. So they might not make an effort to improve. So there we are also contributing to hinder their learning process. Alright? And similarly, severity bias. So this would be the other way around, being excessively strict. Alright? So that also should not take place when you are giving a marking or evaluating a student's performance. Alright? So, next time when you do any assessment, please reflect on this. Okay? Awareness is very important. Okay? Whether am I doing halo effect or am I towards too strict, am I too lenient? So you need, as an educator, you need to have a self-reflection. Alright? Awareness is the first thing that you need to come up for a fair and objective assessment. Alright? Sometimes, remember, bias does not happen intentionally. We might think that we are giving, but unconsciously this might take place. Alright? So, moving on, our last activity, I believe, activity which is which. So, now let's see whether we can recognize this biasness in the practice. Alright? I will show you I have shared with you 5 short scenarios. Okay, your task is simple. Read out each scenario and try to identify which type of bias is that particular scenario falls in. Alright? So I'll give you 5 minutes. This is very short activity. So I think you can complete within 5 minutes. Alright, so looking into the first scenario. Okay, so a student, this is a scenario of student who are very friendly and communicate well with patient. The instructor rate all domain highly despite weakness in the clinical reasoning. So what type of bias this could be? So everyone will agree with the same. Okay, so this contribute to halo effect. Alright, next we have students who come late twice during placement and the instructor gives low rating. So on effect. So that is where we give mark despite based on their weakness. Alright. Next scenario, instructor prefers students who are outspoken because they are outspoken. They are also outspoken because they are also outspoken. Alright. So what is this?
Similar to be biased.
Yeah, similar to be biased because they resemble the same character. Alright? Next, an instructor gives everyone high mark because they do not want the student to fail. Easy for them. Otherwise, next they have to see the same student. So, what type of bias is this?
Leniency.
Leniency, alright? And the last one, an instructor rarely award high score because they expect students to perform like an experienced clinician. Come again?
Severity bias.
Severity bias. So that means to say they are the strict ones. Alright? So yeah, with this activity I believe that you are able to identify what are the different bias. Okay? So the key one, the take home message as we conclude this section. Alright? I would like to leave an important message here. When it comes to assessment, you have to assess the students based on their performance, observable behavior. Alright? Do not assess the student based on your assumption. Alright? And or based on how you feel about the students or based on your past experience. Do not assess based on that. Okay, it has to be always based on the criteria that we have set for all the students, and that criteria has to be consistent. Okay, and the third thing is where what they perform, that is what we get. Okay, so these are the key take-home message for this section. Any questions before we move on to our last section for today? Any questions?
Yes, I have a question.
Yes, please.
Okay. So I think I believe everyone is giving assessing a student based on their performance. Okay, but when it comes this happens sometimes. Okay, but when it comes towards the end of the semester, we are instructed to raise the students' mark to make them pass by the higher people. Okay, even though the student performed very poorly, but we are required. So sometimes when they are required, they have to follow the higher people's instructions. Okay, so so at the end, we can see sometimes there's no difference between the student who perform poorly and below average because of the addition marks given. So how do we handle this situation? Because this is also one of the biasness. So how, as an instructor, how to handle this situation?
So talking about this is a complex situation, right? I think when you are telling about the manager that instruct you, I think it is always best to have a good communication. Communicate first, alright? And why such decision has been made, alright? So through communication, through mutual understanding, that is where we can go into this, alright? Because this is something to do with the organizational factor, alright? Do you all have any other opinion where how we can overcome this situation? So again, I would say definitely communication. Communication is the key for us to make set a goal and come to a decision. Any take home from
What about if the communication doesn't work? It's come like a forcing situation.
Communication doesn't work. So how are we going to handle that? So if communication doesn't work, then you have to communicate further to the higher management. So if let's say you are communicating to your immediate supervisor, and if it's not agreeable, then you need to go to the next level. Okay? So that's why, as I said, this goes back to the organizational affairs. That I'm not going to touch much more on that. Alright? Okay. Anyhow, as much as we can, we should be, being a clinical educator, being a professional in this field, we should evaluate them based on the proper assessment criteria. Alright? Okay. So, is there any question? Good points that our friend has raised up. Is there any other questions that you have? Alright, next. So far, what we have explored is where we have learned, going back, we have learned on different teaching styles, how to properly mentor, okay? And we have also learned about assessment. Okay, the last puzzle to fix today is on feedback. Okay, so I believe every one of us are giving feedback, but the question here, as I raised just now and as I shared just now, whether are we giving the correct feedback? No matter how much assessment you give them, how much rating, if you are not going to give the feedback for that, if you are going to share your student, okay, you have scored 30, but if you are not going to give the feedback where they have gone wrong, what are the things that they need to improve, then the marking will remain the same. No matter how fair you have rated, no point if the feedback is not given accordingly. Accordingly, I would say more constructively. Right? So with that, we're going to explore on how we can actually give effective feedback to our students. Alright? So quality feedback can improve significantly the students' learning. Okay, so before that, let's explore further. When we talk about feedback, feedback is not just giving comment, but feedback will actually help for a student to improve themselves, enhance their learning and enhance their growth. So that is the reason why we want to give feedback, alright? Not to find fault or definitely not to find mistakes, alright? So the idea, the main goal of giving feedback is for them to progress further, alright? And when we giving feedback, there are few things that why we want to do this. So one of it is where, as I said, performance. Okay, we want our students to know where they stand and where they should improve. Okay, and when you give feedback, you can actually identify where exactly your students stand, which are the areas that they are performing well, and which are the areas that they need to improve. Okay, sometimes like student A, they might do good in subjective, student B might do good in objective. So with the feedback that you're going to give, you can correct. The feedback may not be the same for all. Okay, I need you all to improvise. So improvise what? So it has to be specific for that particular student, so that they know where exactly the area of weakness. Okay, and from there they can work through that weakness. And of course, constructive feedback will actually encourage the student to take new challenges. Okay, this time I got my presentation low mark. Next time I need to improvise. Okay, improvise in what? In my presentation, in my slides, in my content. So that is where it has to be more constructive. Alright? And of course, feedback will also help to enhance their clinical reasoning. Why they have done such way? Why they have not checked red flag sign? Okay, why they simply transfer without asking the consent? So all these will actually enhance their clinical reasoning when you give feedback. And of course, ultimately it will help to promote lifelong learning. Okay, so this is where the student will reflect back and learn from the experience and they try to improve continuously. Moving on, let's start with the clinical scenario. Imagine you're observing student during a patient assessment, alright? And I want you to read this entire case and let me know how or what type of feedback would you provide. Okay, I give you 2 minutes to write your feedback in a piece of paper. Okay, reading this scenario, what feedback will you give to your scenario, your current student? So, looks like everyone has completed. Okay, so let's move on to the feedback. Let me hear what are the feedbacks that you give to your students being a clinical educator. Yes, who wants to start first? Student. But the approach that we use is different from one another. Okay, so some maybe start by asking why you went wrong, straight away acknowledging. Okay, some will start by pointing out the good part before they go into the negative aspect where they have missed out. Alright, so as we can see, we have various way of how we approach the situation. Alright, so let's look into how we can actually structure a feedback in a more effective way. Okay, there's several, actually if you look into the current practice, there are a lot of ways that actually we can structure the feedback. And in today's session, I'm going to share two different type of approach that you can actually give feedback. Alright, so one is based on SBI feedback model. Okay, so this framework actually tells, rather than saying directly that you missed out an important question, or rather than pinpointing directly, we will follow the SBI model. So the first thing is where we understand first the situation, where and when it happened. Alright, next we understand the behavior, what happened actually, what exactly the student do. And third is where the impact. So what and why, when the students are doing not taking the red flag sign, what is the impact? Okay, so these are the things that we look into when we are providing feedback. So looking into the previous same example, based on this model, so this is how we can actually provide. So when it comes to situation, so you can tell them during which situation, okay, during your initial assessment of patient with low back pain. Sometimes throughout the day, patient might see few cases, so you need to point out which exactly the scenario or cases that you are referring. Then next is where we talk about the behavior. So this is where you need to highlight the question that red flag sign has been missed out, like your bladder symptoms and your bowel changes, all that were not included. Okay, you point out the behavior that you have noticed that students have missed out. Alright, and moving on is where the action. Okay, so this is where this is where you need to follow up with action. So what kind of assessment you should have done, okay, in order to ensure that all the key information is not missed. Alright, and when you miss this, what would be the impact? Alright, so these are the SBI framework that we would want to follow when it comes to clinical. Am I making it clear? Alright, so first thing is where understand what is the situation, point out the behavior, and very important, impact. If you never draw the impact, sometimes students might take lightly. Okay, they may not know red flag sign, so what if I never take? Sometimes they tend to be ignorant on that. So that is why it is very important for you to cultivate and incorporate the impact. Tell them why impact is very important. Okay, why, what happened if they are not doing this. Okay, so not taking a red flag is something bigger thing. Okay, if you ignore that, it can affect the treatment outcome. So you need to tell that, point out that. Okay, so these questions are important to identify the problems. Okay, alright, moving on. We also have another method is where Pendleton model. Okay, so here here is where student identify. This is more of independent or active from patient side. Okay, active feedback from the patient. So you get the patient to actually identify what went well. Okay, and you start with reinforcing the strength. Talk about all the good things. And then moving on, you identify what are the areas for improvement. And you discuss what are the areas for improvement. And next, what is the plan that they should do. So this kind of approach is different from SBI approach. Okay, for SBI approach, we are more of a clinical educator centric. But here, student is the one who tend to identify what good thing that they have done, what the worst thing that they have done. Okay, from there, we as a clinical educator set a goal with the patient and tell them what they need to improvise. They need to identify themselves what they need to improvise. Okay, so we see whether we can agree with the action plan. So this is based on the Pendleton model. Okay, so looking into the same scenario here. So first thing is how we can prompt them is where we ask the student, okay, could you tell me what are the things went well during your assessment that you did for that particular patient? And student will tell, oh, I have communicated well, I have completed all the physical examination. Then student, as an instructor, we reinforce, oh, okay, good, we agreed with what you have done for your patient, your communication was good, your examination skill was good, alright? Then, next thing we check further, alright? Ask the student what could be improvised. Okay, we talk about the strength and then we talk about the weakness, alright? So what do you think you can be improvising? Instead of we directly tell, oh, you need to do this, you need to do this. Let the student critically think where or which point they have missed up. Okay, so the scenario goes like, why do you think you could have done differently or you have improved, you should have improved, alright? So then students start to look back and think back what are the things that they have missed out during the assessment component, alright? So then once students has shared the finding, then you can come up with the agreement. Yes, you have missed out this point. Okay. Let's say if the student cannot come to the point that you have missed out, you try to facilitate further. Alright. Instead of directly spoon feed them, let them do the thinking. Alright. Then finally we come to develop an action plan. So what strategy that would help you to remember red flag screening? So maybe you need to write a proper subjective assessment flow, improvise practice on that. So when both educators and students come into agreement, let the student follow that. Okay, so this is how we actually provide feedback to the students. So there are two different approaches. And which approach do you use?
Both.
Okay, so we can actually use both the approach, and we can use approach based on when and how. Okay, when and where. Alright, basically. So as you can see, the difference between these two models. Okay, Pendleton model is more of learner-centered, whereas SBI model is more of the instructor direction. Instructor is the one giving the direction. You do this, you do this, you do this. But on the other hand, they are themselves try to understand what they have went wrong. So could you all see the two different approach? Alright? Okay. So here students speak first, instructor here, whereas here instructor give feedback. Alright? So both when we talk about Pendleton model, it is useful for teaching and mentoring because these students tend to think. Alright? Whereas when it comes to SBI model, when you want to give performance feedback, it is useful. And when you compare, SBI model is easier, quicker, you can do daily basis. But if you go to do Pendleton model, it will take longer time because you need to spend time to the patient. Alright? So, based on that, you can use Pendleton model when you are conducting weekly review. You can't do daily basis because, as I said, it consumes more time. If you want to go and give immediate feedback, then you go for SBI model. What you have done wrong, what you need to do, what you can impact. Alright, unlike the Pendleton, at the end of each week, sit with the student, what you have done wrong. Ask them to initiate their own reasoning, where they have wrong, and ask them. This way, they are able to develop the clinical reasoning and they have a better reflection. Alright? So, unlike SBI, we are addressing and correcting unsafe practice immediately. For example, in case of transfer or transferring a patient who are having high chance for fall, you can't wait to give the feedback towards the end of the week. It has to be immediately. So, based on which is necessary and which is right at that particular time, you can plan and accordingly you need to give feedback. But as I said, it has to be a complete version. Don't just tell them to do that, but why they need to do that. What will happen if they never do? So this is very important key point that you need to highlight to your students. Okay? So as a physiotherapist in clinical placement, you can do both. In a simpler form, SBI is for daily feedback, quick, specific and behavioral focus, and Pendleton is more formal feedback session, reflection. It can be for development purpose. Alright? So ideally, you can work in both ways when you are giving feedbacks. Alright? And next one is where now we have explored different type of feedback. So we have two different models. Let us look into what actually makes an effective feedback. Alright? So regardless whether you are using SBI model or whether you are using Pendleton model, regardless of the model, the good feedback should include timely. Okay, that means to say provide feedback as soon as possible while the experience is still fresh. And if it is going to compromise the patient's safety, then don't wait at the end. Then and there, as what the first group has pointed out. Okay, they don't wait for the student to do the treatment and at the end, especially when it comes to important things that need immediate addressment. Alright? And your feedback that you are giving, it has to be specific to the behavior's action. And do not give, oh, I want you to improvise your subjective assessment. No. Okay, what subjective assessment you want the students to improve? Oh, you need to write in detail about the brain scale. So this is what, be specific to the exact point that you want them to improvise. Okay, because when it comes to documentation, when we write generally, student may not be able to understand that. Okay, next, objective. So feedback has to be observable fact. Whatever the student done, based on that, we are going to give the feedback. It's not based on what we judge or what we assume. Alright? And next, of course, when we are giving feedback, it has to be in a way where we have to be in a polite. Okay? Our idea is to not bring down the student. Our idea is to encourage learning and to correct mistakes, and of course, to enhance the learning curve. Alright, so that is the ultimate goal. Okay, and when you give feedback, you also need to have action plan. Without action plan, you don't know next time if the student has improvised in this. Otherwise, after 2-3 months, the student tend to forget and end up doing the same thing. So that is where we need to have action-oriented plan. Alright, so clear guidance and what they need to do for improvement. Okay, So it's good if you always can follow with that particular component that they have missed out. Okay, so effective feedback in general will help students to grow and build confidence, alright, and improve their performance. Okay, so now I'm going to share. I think there's is there any activities in the envelope? No, right? I believe. Okay, I think I forgot to include this. Anyhow, so this is a feedback on sorting the challenges. Alright, so your task, okay, I have few feedbacks here. Okay, we're going to identify which is effective feedback and which is ineffective feedback. Alright, so let's discuss all together. Alright. Okay, so the first thing, you are not confident. Is that an effective feedback or ineffective?
Ineffective.
Ineffective. Alright, why is ineffective? Just point out what you are telling exactly, we are not clear. Alright? What about second, you completed the assessment confidently?
Because we are telling their plus point first, their strength.
Okay. Alright, so we can consider that as a effective way of giving feedback, right? Next, patient may benefit if you speak slightly louder when providing instruction.
Effective.
So effective, this is direct to the point, specific, alright? You need to think more. Fourth one. Ineffective, too general, right? Think about what? Subjective, objective, what? Patient treatment. So the student may be clueless. Alright? Next, I noticed you hesitate before explaining the exercise program. Effective. Okay? Alright, because there's clear direction. Next, with more practice, your confidence will continue to improve.
It can be both because which is specify which skills.
So I think it has to be more specified. Okay? 7, you should be more confident minded now is somewhat the same with the first one, alright? Which you can say as a ineffective. 8, effective. Alright? Yes, very good. 9, effective because we are telling the proper direction. Last, let's set a goal for you to lead the next patient education session. So this is more of effective format. So with this, I hope that you have some clear picture on how you can give an effective feedback. Alright? Alright, so we are not going to go into this much. Alright? So anyhow, this will give you, as what we have discussed earlier, how to provide a proper feedback. I will only take one example from here. You should know better than this. So I'm sure this is an ineffective. But how we can improvise by giving a proper feedback? You completed most part of the assessment well. However, the red flag screening was missed. Let's discuss this to ensure that this is included in your assessment. So these are more effective and directive comment rather than general. Okay? So next, let's look into the common mistake that happen when we give feedback. So based on what we have done the activity, reflect back. If a comment is too vague, too general, less clarity, then that is not effective, right? Okay, similarly, comment should not be delayed. Okay, you have to point out right after the session or as soon. Okay, sometimes right after the student might have other patients, but as soon. If you're going to give feedback after 2 or 3 months, do you think student will remember? Even you might yourself forget what are the points that you want to point out. So that is where immediate feedback is very important. Avoid doing or giving delayed feedback. Alright? And personal criticism. Do not damage the student. Oh, you are so bad. Every time you do this. So instead, focusing on how you can actually build their confidence. Okay, so look into that. And if there's no action plan, then obviously the student may not have any direction where they need to go the next step. Alright, so this is where you need to set a clear direction. Okay, next, as I said, giving feedback is not easy, right? All of us come across, in previous discussion we have discussed, students can become defensive. There are students who become emotional, they cry. Suddenly we also will be wondering why suddenly the student out of sudden crying. Okay, we never would have encountered that from that particular student. Okay, and students show overconfidence or attitude. Okay, and students are not improving, they still having a poor performance irrespective of the feedback. Correct? And student resist your feedback. So you need to, for resist feedback, what will you do? You need to seek mentor. Have the mentor, then you see, understand what is the problem. Okay? And finally, repeating the same mistake. Alright? So remember, when giving feedback, it is not an easy thing, but it has to be a constructive way when we want to give a feedback to our student. Alright? However, difficult situation that you have encountered, alright, is normal. Okay, sometimes, as I said, these are the scenarios that some of you all might encounter. But how we can turn this into learning opportunity is where through our toolkit box. So these are the key points that you want to take home when you are giving feedback. Alright, you need to have active listening, be empathy, alright, acknowledge first, don't straight away give your input, understand first the entire picture, alright, and you can use the SBI model, observation based feedback, or Pendleton model, reflective feedback, okay, and coaching further, and of course lastly you want to follow up with the action plan. If you're going to do this feedback with the right approach, difficult conversation can become a powerful conversation. Alright? The ultimate goal of giving feedback is to maintain a positive learning environment. We want the student to reflect back what and where they went wrong, to support them, and of course, we also want to look into patient safety. Alright? We don't keep quiet until the patient do a mistake where can compromise patient safety. Alright? So that is where we need to give feedback. And remember, when we are giving the feedback, it is not to argue to them. Alright? It is not to prove that you are right, they are wrong. That is not our goal. Please scrap all that. Okay? The goal is basically to improvise and improvise students so that they don't do the same mistake. So that is the ultimate goal here. Okay, keeping that in mind, you should be able to follow through the proper specific method of giving feedback. Alright, since we have last 10 minutes, let's just go through one of the case scenario. I have few case scenario, maybe I can share you this content. Let's go through one case scenario. I think we have 3 different cases. Emotional student, we have overconfident student. I think the most difficult is where the defensive student, right? So most of us have faces challenges, right? So this is a situation where a student receives feedback regarding their poor patient communication. Okay, you call the patient up, you tell them, okay, hey, look here, this is what I noticed. You have explained to them. But what was that, their reaction is like, oh no, this is how my previous instructor taught. Oh, this is what I do, I don't see anything wrong. So they can become so defensive. Alright? So the first thing is where we need to understand what is their root cause, why this happened, why are they becoming so defensive. There should be a reason why is that happening. So is that fear of criticism, embarrassment, they want to protect, they want to have a shelter, alright, or they want to justify their action. or they cannot look into their insight into their performance, drawback in their performance. Okay, so you need to understand, acknowledge first. Okay, the first key point here. Alright, and these are the things in this situation you should avoid. Okay, focus on the behavior and not on proving who is right or wrong. Alright, so when it comes to this, avoid arguing, interrupting, or become confrontation. Okay, instead what you can do is acknowledge the students, focus on what are the behavior, and you can ask a reflective question. Okay, so for example, I understand that you have used this approach before. Let's review today and work. And how do you think the patient responded to your explanation? Why am I telling communication is faulty? How the patient has responded. So you explain to the students on this. Alright? And with that, this is a summary where we call it as ACEA model. So these models help to target a difficult conversation. Okay, first thing is where you need to recognize the student perspective, as I said. Understand what is the reason behind the behavior. Alright? Second thing is where you need to clarify what went wrong. Okay? Third is where understand their reasoning. And finally you come up with the action plan. So, the key goal here is where to turn a challenging conversation into learning opportunity. So that is what we are going to look into the end. Alright? So, alright, so as we conclude this session, I think I would like to leave a feedback for this session. Alright, so the idea of we giving feedback to students is not to paralyze them, it's basically to correct their performance. And whatever feedback that we are giving, it has to be specific and it has to have a direction. Okay, without the direction, whatever feedback that you're going to give, it may not be useful to them. So direction is very important, what they need to do. Okay, so that they have a clear picture. Alright, and if you can follow up with what they should do, that will be even better. Alright, so this is how you can actually correct their performance and build their confidence. Alright, any questions you all have? Any questions? I think we have come to the end of our today's session. Alright, as we conclude this session, I would like to recap on what we have learned during the entire session. Okay, so we have looked into what are the various teaching styles. Okay, so if you remember, we have learned about the demonstrator, director, facilitator, mentor. So these are the various teaching styles. And the key point here, we understand that different student needs different teaching styles. There's no single teaching that will be effective. Okay, moving on, mentorship. Why mentorship is important? Because clinical educator is not only all about teaching students, but it's beyond that. Okay, we need to mentor them to support their learning. Because mentorship may not be done much in the classroom teaching, but when you go to clinical, you interact students regularly. So that is where mentorship comes into the play. And assessment. As you all know, all of us give assessment, but there is subjected to bias without we knowing. So we need to look into how we have to give assessment so that we have to prevent bias, and the assessment that you have to give, make sure you follow the criteria. Objective, consistent, fair for everyone. It has to be enhancing their learning growth. Okay, and feedback, the last one we have discussed. Okay, feedback that you are going to give is where it has to be constructive. Very, very important. If it is not constructive, then it is not a feedback. You are just telling a general comment. Okay, and another important fact is where it has to be timely. Okay, and depend. If immediate attention has to be taken, you have to give immediately. Alright? So, with all these key points here, I believe that we can be a better clinical educator that can bring independent physiotherapy students. Okay, students who are independent and successful. Okay, with that I end my session.